Hello guys. So the topic for today is tumors of the pleura. One of your final exam questions. Let's begin. So like every tumor question, we start with the basic classification of benign and malignant. And in some questions, we can also put the category of pseudotumors. So for example, in the case of pleural tumors, we can put the category of pseudotumors under this question. Also, I put some stuff from Professor Bui's presentations of lungs in this presentation, because I believe his PPT was very precise for the final exam questions, and I used it as well for the revision before my pathology exam. So I think you might find it useful as well. So let's begin. So when we talk about pseudotumors of the pleura, we mainly have to just talk about the one main one, which is sort of common. It's called reactive hyperplasia. What it means, it's basically a reactive mesothelium arising from some inflammation or irritation in the pleura, and it will mimic tumor, so it will be sort of like a mass. Histology is not so important, but it's just here for you to give it a read in case you're curious or want to understand it properly. So there's mitosis, high cellularity. I mean, of course, it's a reaction, so it's proliferating. You might see some inflammation in atypia, and it's in the form of papillary formations. No invasion, no necrosis, so it's not malignant. So this is a pseudotumor, reactive mesothelial hyperplasia. Next, the main category, benign. In the benign pleural tumors, we have three main tumors: edematoid, well-differentiated papillary mesothelioma, or benign primary mesothelioma, and the very important one, solitary fibrous tumor, also known as pleural fibroma. So for the edematoid tumor, it's you just even if you just give the name, it should be enough for your examiner. You don't need to talk a lot about it. It can be found in genitourinary tract as well as in the pleura. Histology, not so important, but like cystic architecture, hence the name edematoid. Sort of like glandular architecture and with gland cytology. No, you don't need to remember or understanding. Next, which is important, is benign papillary mesothelioma. Like anything you can say, both the names will be fine. It's rare, and it looks like a microscope velvety look, sort of benign tumor. Again, in the name itself, you have the name papillary, so it will have a papillary structure histologically, maybe with some myxoid stroma and some cubic flat cells without atypia. Okay. What's important for you under the benign categories to speak about, or also known as the solitary fibrous tumor. Again, uncommon, but it is due to some genetic defect. Histology is not clear. It's mainly made up of different kinds of connective tissue, collagen, hyaline, myxoid, maybe vessels. It looks something like this, the SFT or the pleurofibroma. It's a solitary discrete lesion, well circumscribed, for mass small, 3 to 10 centimeter, made from dense fibrous connective tissue. So like various kind of connective tissue. Yeah. Okay, so this was about benign. Now we move on to the malignant. And like every malignant tumor category, we divide it into primary and secondary. In the case of pleura, I think you already know the secondary tumors are more common than the primary malignant ones. And where are the secondary tumors coming from? They are the bronchogenic carcinoma, lymphomas, and breast tumors metastasis coming to the pleura. And you will have, if you have already learned the lung tumors, you will have noticed that it's similar to what metastases were coming in the lungs, and they will present as like sort of small nodules on the lungs, all over the lungs. Okay, so the primary malignant tumor of the pleura, you mainly talk about mesothelioma, which is, I think, the only primary malignant tumor of pleura. So mesothelioma is rare in older men. Risk factor: previous exposure to asbestosis, and very aggressive. It may not metastasize. It may not metastasize. It may have like low metastatic potential, but it is very aggressive in the sense that it is close to the lung and will invade the lung, like local invasion, very quickly. How it looks like, we'll see in the picture, but for description, the microscopy of malignant mesothelioma is thickened, whitened pleura with pleural effusion. Very important. This whole sentence is very important. So like just stick it to your brain. Prognosis is bad, but it also depends on the type of mesothelioma we are talking about. So there are like four types of malignant mesothelioma. Epithelioid, the most common one, looks like somewhat like papillary lesions. Then biphasic, somewhere between sarcomatoid and epithelial. Desmoplastic is a lot of collagen, and sarcomatoid is like similar to collagen appearance under my microscopy, spindle cell appearance. You need to know the four types, the names at least, so your examiner knows if you know your knowledge properly, because the prognosis also depends on the type of mesothelioma you're dealing with. So the epithelioid, for example, has the best prognosis out of all the four. And the metastasis for mesothelioma would be hematogenously or lymphogenic, so it can be either. Okay, this is an image of malignant mesothelioma. Like I said here, thickened whitish pleura, diffuse or nodular, and with pleural effusion. And what are the complications? Very important. Tumor spreads directly by direct lung invasion and indirectly to the hilar lymph nodes or pericardium or lymph. Okay. Prognosis is terrible. Prognosis: 50% of patients die within 1 year. So this was about this question. I think I mentioned all of the stuff which you need to at least say in your exam. If you say more information, of course, that's well and good. But even if you don't, just say whatever is there in the PPT, and you will be good to go, hopefully. All the best.